Welcome to DocPod. Hear health.
Hey, Kelley. Nice to have you on the show. Welcome to DocPod.
Thanks, Jeremy. Thanks for having me. I'm excited to be here.
No, absolutely. I'm excited to have you. So just by way of introductions, you are my, former, but still current family practitioner RN, but then also are the current co-founder and chief medical officer of Medical Anti-Aging. So wanted to talk about that, kind of your path to get here. So if you want, just introduce yourself, some of the certifications and practice that you've done over the years, and get to now and can go from there.
Yes, absolutely. So yes, I'm a board certified family nurse practitioner. And my practice here at Medical Anti-Aging is really centered around regenerative medicine and really longevity strategies for helping people navigate, really, I would say, the midlife transition. That's really something I'm passionate about. Especially passionate about helping women navigate the midlife transition. So anywhere from late 30s to early 40s, we kind of see some hormonal changes and things starting happening. So that's something I'm especially passionate about. I really got into this for many, many reasons, but one in particular is that I have amazingly healthy and wonderful parents who are just turning 70. And over the last, I'd say 30 years, watching them really thrive where many of their friends weren't, really kind of spurred my interest in especially hormone therapy. My parents have been doing hormone therapy since their 40s. I remember them doing this, and they were kind of on the forefront. Yeah, they've really been. So it just spurred my interest in longevity and how can we age well and gracefully. So that's what caused me to go back to get my master's and do my nurse practitioner program so that I could kind of help people in a different way. I worked as a nurse for 10 years in the cardiac intensive care unit and the cardiovascular catheterization lab. And I think that's also something that really just shined the importance of preventative medicine on me, because I was always, patients then, you're playing catch up, right? They're sick, they're tired, they don't feel well, they have cardiovascular disease. And at that point, you're playing catch up. And so I really became interested in how can I help people more on the preventative side and regenerative side of medicine.
So your parents started hormone replacement therapy, or whatever that version was, 30 years ago. So what did that look like then? Can you tell me about the journey that HRT has taken, but maybe even through your parents' eyes and experience for 30 years? I'm 40. So when I was 10, I had never heard of hormone replacement therapy. The only thing I had heard of, as we talked about before, and we'll probably touch on a few different topics with this, but was bodybuilders, Arnold Schwarzenegger. The people that you see at shows, the Ronnie Colemans of the world, where that's the only testosterone or any kind of hormone therapy that anybody ever took. That's what you see on TV, or that's what you see in a show or things like that. So what was that like for them? And how did they even get into it? And how did they progress through it?
Yeah. So I remember them, they must have had a very progressive nurse practitioner who was into hormones, because I vividly remember them saying, we're driving to go get our pellets. So they did hormone pellet therapy. Well, we can get into the different types of pellet therapy, but I remember them going together, getting their procedures in the office with their nurse practitioner, and just telling me how great they feel. And, my mom, being a woman, she went through menopause a little earlier. She had some hormonal issues, and the fact that she got on estrogen replacement, progesterone replacement, testosterone replacement back then changed her life. I mean, literally changed her life. And now I look at her at 70, and she is really a picture of health. I mean, she feels incredible. She has incredible muscle mass. She's strong. Her body is able. Her mind is able. And same thing for my dad. He got on the T way back when. And was never a bodybuilder type guy, nothing like that, but he's healthy. And I think one of the really important things about it too is that at 70 years old, their sex life is thriving, and it's important to them. And that was something that was very important to them also, to maintain that part of their life too through the aging process. And they're coming up on their 50th wedding anniversary, and they are alive and well. And it was just really inspiring.
Man, I gotta think that is what you just said is incredibly important to a listening audience, because as you age, You may think about the hormones, but you know about the lack of sex drive. And my parents, I don't want to talk about my parents' sex life, but and I won't. But my dad's 75, my mom is 67, and you see your parents age, and you see yourself start to age as they do. And I personally refuse to look in the mirror and see myself as a 40-year-old man. But all of that to say, you don't think about 70-year-old people having a active and thriving and healthy sex life. So that's got to be very, very important. As you're talking to somebody that is in their 40s or even 50s, it's like, hey, this is something that is preventative care, but also something that kind of elongates your quality of life with your partner.
Absolutely. And this, I tell my patients all the time, sexual health is just as important as physical health, as mental health. It's no different if you are struggling in that department. It's no different than if you're struggling with diabetes or high blood pressure or other types of diabetes. I mean, sexual health is all encompassing, right? It's a part of the whole picture of health, and especially in the aging process. So,
yeah, absolutely. So tell me a little bit about the medical anti-aging practice. So we talked about, testosterone and hormone therapy from 30 some odd years ago, but into what it is today. Tell me some of the things that you touch on, maybe even a high level, and we can dive into a few of those individually after.
Yeah, absolutely. So really the concept here is that we want to help patients live well. And, not necessarily extend the lifespan, because that, although that's important, but it's really the health span that you want to extend, right? Because there's no point in living long and not healthy. So we utilize different modalities that can really help on a cellular level to extend the health span. So we do a lot with something called peptide therapy. Peptides are cell signaling agents that go and help a cellular process to be more efficient. There's a peptide for everything, so we love our peptides. I am, again, like I said before, but passionate about hormone health for men and women. So that's something that I spend a lot of time on, and really, and we're growing a good following and patient base of people who come desperate for help. People come in desperate for help, and we are able to provide treatments that truly work and truly help them. And then another part of something that we do is the aesthetic world. So I am an aesthetic nurse practitioner also. So I guess I would say we really work from the inside up. We kind of hit all of the things. It's a really cool model that we have here, that you can come in one place and we can help with hormones. We can help with peptides. We can help with weight issues. And we can also do some of the really cool regenerative aesthetic procedures as well.
Okay. So peptides, that's a word that I knew just because I had heard of it, but I had no idea what they were at all until I met you, really. And, was familiarized with this through medical anti-aging. And I am self-educated, but then also educated by you because I'm one of your patients. But even so, tell me a little bit about, a peptide is, from my understanding of it, just a naturally occurring amino acid, but then that is supplemented in the body as it stops producing it. So there's hundreds of them, but depending on what you need and an exact combination and protocol for what your body is experiencing and or may experience that you want to prevent, that's what you're able to do for patients, and it's all individualized, of course. But tell me a little bit about maybe the main ones, the top 2 or 3 or 4, if there are more, great, but that you are prescribing and or seeing a need for, and why.
Sure. Well, I'll start with this. One of the most popular peptides that is in every single person's body, and everyone will know this word, is insulin. Insulin's a peptide. Insulin's produced in our pancreas, and it goes and does its job. It's a cell signaling agent that is released in response to elevated blood sugar. So everybody knows what insulin is. Without insulin, we die. So peptides are fundamentally important in our body. Some of the popular peptides that people might not even know are peptides are the weight loss medications, the GLP-1 analogs. So Ozempic, Wegovy, Mounjaro, Zepbound, those are peptides. Those are peptides that target weight, that target diabetes. And so those are kind of 2 that everybody will have heard of. Everybody has heard of, but some of the lesser known ones that maybe you haven't heard of unless you're in this field. Some of our favorites, BPC, or pentadecaarginate. It used to be called body protective compound. I call that the Swiss Army knives of peptides. It really is an incredible peptide in two forms. One way can be taken orally. That's incredible for gut health. So patients who have inflammatory bowel diseases, bloating, distension, just gut issues, body protective compound is amazing for that. That one also, when done in an injectable form, is incredible for tissue regeneration. So people struggling from maybe a ligament injury, a tendon injury, inflammatory arthritis, things like that. That's BPC is incredible for that. In that same category, TB500. That's another great peptide that targets inflammatory pathways and can be helpful for recovery. Something maybe people have heard of is called NAD. There's quite a bit of buzz about NAD in the anti-aging world. And what we see NAD to be especially helpful for is really strengthening what's called the mitochondria of our cells. So when we go back to, if anyone took A&P or biology, mitochondria are like the engine, or the engine of the car. It's the engine of our cell. Without mitochondrial function, a cell doesn't work. And with age, NAD levels naturally decline, as well as mitochondrial production. So we use a peptide called NAD to really help to strengthen the mitochondria. And the list goes on and on and on of some of the peptides. There's peptides that are incredible for collagen stimulation, hair growth. That's our copper tripeptide. We have a peptide for everything.
Yeah. Mitochondria is the powerhouse of the cell. Is that from Schoolhouse Rock? I believe I remember that exact quote verbatim.
Yeah, it is. It's the engine that drives the car.
That's right. So you mentioned, not really in passing, but as you were listing off some of the peptides that people would know about, Ozempic, which is probably the most popular weight loss peptide of our time, or at least currently. And I'm familiar through you, of course, but with an alternative, but tirzepatide. And I'm not certain, maybe if you could explain the difference between the two, maybe the benefits of one over the other and what that looks like. And the reason being is because it is such a popular prescribed peptide for weight loss that I think everybody's looking for a catch-all and for just being able to push a button and, the magic wand or pill or whatever it may be to lose weight. And for some it works. I know for some it doesn't. I've listened to several podcasts, watched a lot of interviews, and, it may not be the best thing since sliced bread, but, it works for some. So tell me a little bit about maybe the difference between those, or what in particular you're doing for people that come in either on it, looking for it, need weight loss, things like that.
Sure. So I really tell my patients what they're called GLP-1 analogs. That's a class of medication that they are. They are hands down the most powerful tools we've ever had in medicine for weight management. And they work in several different ways, but I really explain it in layman's terms. I help patients to understand what happens. It's really helping to reestablish healthy communication through the gut-brain and the brain-brain, right? This is the strongest, the gut-brain axis is the strongest axis and the strongest communication tool we have in the body. And over time, I really say we've devolved. We haven't evolved. We've devolved, and due to epigenetic changes, due to our lifestyle, due to our food sourcing and what we eat, and we really devolved and most people have really developed this dysfunctional appetite regulation. So we can eat a big Thanksgiving meal and be full to the brim, but somehow we still have a dessert brain, right? And we just stuff ourselves. And that is called appetite dysregulation. Our brain, the gut signals aren't getting to the brain properly to tell us, stop eating. So these medications, these GLP-1 analogs, help to reestablish that healthy communication, to signal feelings of fullness faster, to decrease cravings. And they work through several different mechanisms, one of which is that it slows the time that food empties the stomach, not the colon, but the time it empties the stomach, so gastric emptying. And in that, those signals from the gut are getting to the brain more efficiently. Say, okay, I'm full, and you feel full longer. They have a profound effect on increasing insulin sensitivity, so glucose utilization and insulin sensitivity. The hallmark of diabetes, which is an epidemic in our country, the hallmark of that is insulin resistance. So we have this peptide that can improve insulin sensitivity. We are even seeing now, and there's an indication with Wegovy for reduction for cardiovascular risk disease. So we have all different indications. It used to just be diabetes. And here I'll kind of lay the two out. So semaglutide is branded as Ozempic, and that's FDA approved for diabetes management. Its sister, called Wegovy, also semaglutide, is FDA approved for weight management. So that's been around for a long time. I've been prescribing Ozempic for my diabetic patients for many years. About 2 years ago, a new peptide came out called tirzepatide. So that's a GLP-1 analog plus an additional molecule called a GIP. And tirzepatide is FDA approved as Mounjaro for diabetes, and we have FDA approval as Zepbound for weight management if you meet certain criteria. The tirzepatide was just, it's just Ozempic on steroids a little bit, if you will. It's just more effective, better blood glucose control, a little bit higher percentage of weight loss. And I find personally in my experience with patients, a significantly less side effects. So tirzepatide for me is my choice of peptide for helping my patients. And they're profoundly powerful. And I say all of that to say, it is not the be all end all, just like what you said, people are looking for a quick fix. It is not the be all end all. It has to be, it's a tool in the toolbox with lifestyle modifications being the cornerstone.
Yeah, exactly. Excuse me. I would have to think that if I was a person in general that needed to lose weight or just wanted that, the catch-all, right? And I did it, and it's a quick fix. And over 3 to 4 months, I lose 50 to 100 pounds. But you can't just do that and then stop and then be the same person, right? It's in diet, it's in exercise, it's in lifestyle changes. So it has to be a complete change in you as a human of what you maybe have been to get to that point, in order to make it a long-standing result, right, from the peptide.
Absolutely. And it also, what happens, we don't know, the medications do cause profound fat loss. So both visceral fat, that's the fat inside around our organs that we don't see, as well as subcutaneous fat, that's the fat that we see. But with that, you can also have profound muscle loss, and leading to even something called sarcopenia, which is really muscle wasting. And muscle is really, we are looking at muscle as our organ of longevity, especially as we're aging in the aging adult. So, there is major caution, and I say strict, but I really highly emphasize the importance of maintaining muscle mass when you are using these medications, because the last thing we want is a bunch of skinny fat people walking around, or people with giving someone sarcopenia. And especially for women, and you would refer to your mom in the beginning having osteopenia, before, what happens before osteoporosis. You could literally make somebody down the line osteopenic giving them these medications if not following the lifestyle recommendations. And so, some of the things I really require of my patients, if you will, is logging and documenting adequate protein intake. So I have my patients aim for 1 gram of protein per pound of ideal body weight. It's a lot of protein. So we sometimes will say, okay, say your ideal body weight is 150 pounds. It might be really hard for someone who's typically getting 40 or 50 in a day to increase their protein by 3-fold. So I may start with saying, let's aim for 100 grams of protein for a month. Work your way up to where we need to go. Another thing that I always insist upon is strength training, resistance training, if you're using these medications. So you have to lift weights, you have to push heavy load. We've got to get the resistance, build the muscle, and maintain the muscle and build. And then something else I like to add in, and I don't know if we'll get to maybe later, but creatine, you and I had talked about a little bit before. Creatine monohydrate is really in vogue in the longevity world. We know that it is something that enhances cellular energy, enhances ATP production. And in that, we not only get the longevity benefits, but it also is great for muscle synthesis. So those are kind of my 3 things that I really require if I'm going to use a GLP-1 analog like tirzepatide in my patients. And the results that you can have if you combine that, it is unbelievable.
I'm sure it's amazing. Yeah, and you touched on a couple of things that we talked about before the show, but talking about creatine and protein intake. And we again talked about this before, but when I was in high school, it was almost impossible for me to convince my parents to let me take a protein shake and creatine. And like the most, I guess, banal or like the most harmless and helpful supplements that you could ever take. But there was zero knowledge about it then, I think, in the maybe uneducated, conservative public, if you will. Just because my parents didn't read up about any supplements or, you know, they didn't get Men's Health or anything like that. So, and all of that was really starting to build up in the probably mid 90s, early to mid 90s. And then by the time I was in high school, which was right around then, it was still not commonplace, not common knowledge. Not many people knew about it other than people that were constantly lifting weights or bodybuilders or in that business or whatever you want to call it. So, talking about that now, right? Because I have to think that there's still a large amount of the population that doesn't understand that protein intake, maybe not necessarily in creatine, is so important, not only for healthy lifestyle now, but for preventative care for later. And we talked about osteopenia, osteoporosis. My grandmother had osteoporosis, ended up falling from, we believe, a broken but frail hip. She didn't fall and then break it. And then I ended up, passing in the hospital post that. But talk about the mortality rate of people with osteopenia, porosis at a later age, and that is completely, well, not completely, but very much so preventable by, as you mentioned, resistance training, by muscle building, by protein intake. And so, I guess all of that to ask, how do you educate a person on the street that has no idea of any of this stuff? And, what do we do to maybe change the mentality of the public in general on like when to start that? I mean, the answer is probably now, but tell me a little bit about this educating the common man, the layperson of, hey, you really got to start doing this or else.
Yeah. Well, I mean, the word you said is the key: education, educate. So by talking to people and explaining it in a way that they understand and a way that makes sense. And also, I am really big on small, achievable goals, right? If somebody comes into me, I talk really fast, do this, and it's overwhelming. And I'm telling them, you've got to have 100, 200 grams of protein a day. You've got to lift weight 6 days a week. People you glaze over and they walk out the door and nothing changes. So I'm really big on setting small attainable goals. So this month, here's my goal for you. I want you to aim for this amount of protein. How do I get that protein? I give them recommendations. Wake up in the morning, have 30 grams when you wake up. Make sure you get 30 grams at dinner. Make sure you get 30 grams at lunch, and in between choose high protein snacks. So I even get really granular, telling them what are high protein snacks. And, so I try to say, let's set these goals for this month. When it comes to training and exercise, it's also very overwhelming for people to hear exercise more and eat less, and you won't have any weight problems. It's way more complicated than that. So let's start with achievable goals. I want you to do 2 days a week of strength training for 20 minutes. And I can show them, here are some compound movements that you can do from home with things that you have in your house, or refer them to find someone on YouTube that there's the resources out there are vast and it's amazing. So I think educating on taking small bites and making achieving small goals. And then you can kind of compound on that. It is, I really like I do a little stack with my patients. Here's what we want, our goals for protein. Here's our goals for strength training. I tell every single person in the entire universe to get on creatine, even older adults. I tell, especially for my women, start with 3 grams a day. You are not going to get water retention. Bloating, if some women are more sensitive in their guts, start it for 2 days a week till you get used to it. Then go to 3, then go to 4. But 3 to 5 grams of creatine monohydrate is kind of the sweet spot. I've been on creatine for about a year. I was introduced to a company called Gainful. It's my favorite personalized nutrition company. They're based out of New York. One of my friends works for them, and she had given me one of their hydration packets to try, and said, "Oh, this is cool." So it made me go to their website and look. And they had a blog about creatine. One of their dietitians wrote this blog about creatine, and it was eye-opening to me. I did not even, this is what I do for a living. Even a year ago, I still was under the misconception that creatine would make me big and bulky. I had no idea the unbelievable health benefits not just for the muscle synthesis, the ATP production, but we're now actually seeing mental health benefits. We're seeing cognitive benefits in aging adults as well. So it's really kind of an all-rounder. So so part of my stack for my patients is your protein, your creatine, your strength training. And here's what we know too in longevity medicine. There's an incredible Dr. Gabrielle Lyon, who has championed what she calls muscle-centric medicine and has done incredible research on how protective muscle, the organ of longevity, that's what she calls it, skeletal muscle tissue. So the quality and quantity of our skeletal muscle tissue is directly tied to our longevity. Myocytes, the cells that make up muscle cells, stimulate and help protect our immune system, protect our brain, obviously musculoskeletal benefits, but really so that's how I talk to my patients, is say, you have to think of skeletal muscle tissue as a separate organ in your body that is directly tied to your longevity.
Yeah. No, absolutely. And that's unbelievably insightful. And I'm certain I didn't know half of that. And I feel like I've been a healthy, athletic, exercising adult for the majority of my life. Since I've been working out since I was 13 or 14. Whenever I, hit puberty, my dad was like, all right, you're not going to stunt your growth. Even then, it was like, I probably could have worked out sooner, but that's neither here nor there. But I wanted to ask, you're talking about muscle loss and muscle degeneration and aging. And of course, it's all in the name, medical anti-aging, and big focus of your practice is women's health. So tell me a little bit about how, as women in general are aging, going through perimenopause and menopause, how that hormonal change in the body. And I coming from a person who is not a woman and doesn't understand any of this and can't empathize, I'm asking really out of ignorance, but curiosity as well, because my mom experienced it, and grandmother before, and cousins, and I don't have any sisters, but I could see that, not knowing what it was, of course, in the women that I love in my life, and understanding it now. I'm like, oh man, I wonder if something could have been done at that time to, I don't know, again, prevent the aging process or help them be more comfortable. I don't even know what I'm trying to ask, because if I was a woman, I probably would be able to. So tell me a little bit about that.
Because I'm a woman, I'm a 45-year-old woman in the throes of it. So I know exactly what you're trying to ask. And it is something that I'm passionate about. And it's amazing. It's an amazing time in medicine for women right now. And it's an amazing time what's happened is that women in particular, and incredible women educators and hormone specialists have really raised their hand saying something has to change. What we have been doing to women is not okay, and it's not appropriate. And I'll back up. Let's back up to 2002 when the Women's Health Initiative study was released that said hormones cause cancer. They took everybody off of their hormones, and women have been suffering the consequences from that time. So here's what happens in a woman's life. We are born with a particular number of eggs in our ovaries. And every month when we have our cycle, hormones rise and fall in response to ovulation. And every time we ovulate 10,000 plus eggs. And those eggs don't ever come back. And once we run out of our egg supply, that is what we get to the end of our ovarian function. And that is really the end of ovarian function. I call it ovarian retirement. I hate to say ovarian failure, but ovarian retirement happens, which is menopause, happens because our ovaries don't have a job to do anymore. And I think that, a lot of this has to do, we didn't used to live long past our reproductive years, right? The lifespan, 100 years ago was pretty much similar or less, even less than a woman's reproductive years. And so the end of reproductive years, end of life, move on. Well, we're now living 30, 40, 50 years past menopause. And how is it that these hormones that were vital and necessary in keeping us alive up to age 45, 50, 55 get completely cut off, and then we're just expected to live without them? Do you know, this is an interesting fact. A man at age, say 55, will have an estrogen level anywhere from 20, 30, 40. Testosterone in the body in men and women aromatizes, converts into estrogens. And men have estrogen. Men need estrogen to protect their bones, to protect their brain, just like women do. A woman at age 55 after menopause will have an estrogen level of 0. So a man will have more estrogen in his body than a woman will have after menopause. And yet we just tell
That is
women,
something that I know no one knows. I mean, other than people that a very seldom few, I'd say the general public has. I had no idea.
no, it's mind-boggling. And so here's what we'll say, where we are now in menopause education. Hormone therapy is safe. Hormone therapy saves lives. And the Women's Health Initiative studies, several of the authors of that study have now come out and said, this was the best we had at the time, but this information was inaccurate. And I don't know how granular you want me to get with it, but what happened in the Women's Health Initiative studies, they did these clinical trials using horse urine derived, so synthetic estrogen, right, equine estrogen, and synthetic progestins, not progesterone, that our body produces. They started the women on treatments after age 60, so far past menopause, with these synthetic estrogens. And that is what increased these risk factors. They saw an increase in breast cancer incidence in the women who were taking the synthetic progestins and the estrogens. They did not see that in the women only on estrogen, but the estrogen and progestins. So we've now been able to say, okay, synthetic progestins can increase our risk for breast cancer, not progesterone that our body makes. In addition, they did see some increases in other risk factors for cardiovascular disease and strokes. But here's why. It's called the healthy cell hypothesis. What we know is that when we reintroduce estrogen and progesterone that our body has naturally been making forever to a woman, in the first 5 years after menopause, we kind of go up to 10, but the ideal window is within that first 5 years after menopause. Your cells are still healthy, right? You haven't developed other chronic disease, hardening of the arteries and certain things. So when we reintroduce estrogen to a healthy cell, we see unbelievable reductions in cardiovascular disease, reductions in Alzheimer's, reductions in osteopenia and osteoporosis, because we're reintroducing these hormones that your body made for all throughout your life before, and we get the protective benefits of reduction in those three things that I just mentioned. There's an incredible Dr. Mosconi, who just is doing the first ever clinical trial on the importance of estrogen and estrogen in the brain for women in prevention of Alzheimer's, and she is trailblazing and making unbelievable strides for women in seeing that estrogen replacement can reduce our risk for Alzheimer's disease. We know this for bones. You know that 50% of women after menopause will have an osteoporotic fracture. If you fall and break your hip,
I did know that. Yep.
Have an osteoporotic fracture, it increases your mortality rate by 30%. I mean, this would be criminal I always say this too, if this happened to a man, we would have a solution. We would have ovarian transplants. The research that has been done for women is really, it's criminal at this point. And we have some amazing people speaking up saying, we need to do better. We need more research. We need to understand this better. And we need to help educate and help women understand, that this is something that is vital to life.
So why do you think that is? And maybe not getting too granular into this answer, but you're welcome to if you'd like. But my thought would be that maybe it was just taken as a rule of law because there was nothing else, and for so long it was relied upon, that study with horse urine. But maybe nobody challenged it until maybe 10 to 15 years later. You're starting to see horrible effects of not treating it correctly, or like, this can't be right because all of the effects that I'm seeing are wrong. And so maybe that just kind of spawned, maybe the regeneration of performing studies on every single part of the hormone therapy protocols. And we had to have gotten this wrong because there's no chance that everything that we said wouldn't happen is. So I have to assume maybe that, but do you have a different perspective on that?
I really think it has to do with awareness. I mean, the advancements in technology and social media and how information is disseminated to people. I think that's a huge part of it, is just having these channels of communication and a few pioneers who were saying, like, this doesn't seem right. Like, why it just doesn't seem right. And people speaking up and being loud and making their voice known and really fighting for and pushing for better understanding of this really paramount issue in women's health. It's a women's health issue, and a women's health issue is a life issue, right? Because, what are we, half of our population here, maybe more than half of the population in our country is women. And so I really just think it's awareness, and I think it's in people who are incredibly brave and inspiring that said, listen, we need to do better. We need to do better for women. Here's some interesting things. We even see economic impacts of menopause. 1 in 5 women will leave the workplace due to menopausal symptoms. That is huge. That has a profound economic impact on our society as well. And that has to do with some of the cognitive changes and things that we see that happen during hormonal shifts. So the average age of menopause in this country is 51, but that can be anywhere from 45 to 55. Perimenopause, however, which is really what we're looking to understand even more, can begin 7 to 10 years before menopause. That means a woman, theoretically, in her late 30s and early 40s is going through these early hormonal changes. And that is because the brain our neurotransmitters are sensitive to our hormones, right? The brain loves to be bathed in estrogen, progesterone, and testosterone. And as we enter this perimenopausal phase where our egg supply is really at a critical threshold, the brain starts freaking out and it's saying, hey, I'm not getting enough hormones here. I'm not getting enough hormones. So it sends these pulses, these surges of FSH from the brain to the ovary saying, I need help. I'm not okay. So then we see these pulses of hormones being released from the ovaries. And it's this roller coaster ride of these up and downs with hormone release from the ovaries. Some people in my world call it the zone of chaos. That's really what perimenopause is. And thinking that in the late 30s, early 40s, this is already beginning to happen is mind-blowing. Most women don't even know that. Mood changes mental health changes are the first sign that we see. So increases in anxiety, mood disorders, cognitive changes, brain fog. I can't find my words. I'm not as sharp as I used to be. Body composition changes, abdominal weight gain, being frustrated that you're doing all the same things you did before, and now all of a sudden your body's changing. Obviously low libido, night sweats, a host of other things, but that can begin in the late 30s.
And I have to think that a person listening to this is going to have to benefit from it, if and only if, because you may just think that that's, hey, I'm getting old, right? Or this is normal, right, and this is what happens. And all of these things are happening. And then I assume probably leads to a higher rate of depression amongst late 30s, early 40s of people that are successful in the workplace and that are just really hitting the peak of their jobs or, getting into leadership positions and, oh my God, I can't do this anymore. Why? And
that's exactly
that
correct.
has to be the most frustrating thing in the world. So maybe getting back into the treatment of it with hormone replacement therapy and what you're doing with peptides and the breakthroughs that you're making at MAA and in general. So how is it that somebody would be treated for that? Or what would be your approach to somebody coming in at 44 or 43 or whatever it may be, when that may start on average, say, God, all of this is happening to me right now, and you wouldn't believe it. And be like, yes, I would. So
yes, I would.
Tell me what that looks like.
Sure. So, obviously patient's history, medical history, family history is super important. So really getting a good thorough history of risk factors for different chronic illnesses and such, and a good assessment of symptoms. There's sometimes women will say symptoms they didn't even know was related to perimenopause. I do check blood work, blood work.
Just to pause. Like what? Like what would those be? Symptoms that they don't know would be related to that? Like what would somebody see maybe day to day and be like, oh, this wouldn't be perimenopause, or wouldn't even know the word, right? But what are some of those things look like?
I would say the biggest one is I just don't feel like myself. I'm not sleeping well. I'm feeling anxious. My heart's racing. I'm jazzed up. My mood is down. I don't feel happy. I don't feel like myself. I don't have the vibrancy that I had, say, 10 years ago. We see a 40% increase in SSRI or antidepressant use in women in the 40s. And really, probably what we see is a huge portion of that is really just related to the hormone changes, not necessarily a issue in mental health issue if you had your hormones. So assessing a good assessment of symptoms. I check lab work really. We look at things like thyroid, vitamin levels, kidney function, liver function, to make sure that there's nothing else contributing to that. Checking hormone levels I do it, but I also know what I'm looking at only one snapshot of that day. So if they had a big pulse of the ovaries released a big amount of estrogen that day, I'm going to see, different numbers than I would see 3 days later. But one important piece that I really focus on is testosterone. So we see testosterone levels decline by 50% in women by the age of 40, so 50% of what they had in the 20s. While testosterone use is not FDA approved for women yet, also criminal, we're getting there. It is considered an off-label treatment, but I think that female appropriate, safe and appropriate testosterone replacement therapy during perimenopause can be a game changer for women. We also see levels
if it drops by 50% at that time, then you are half of the person that you were 10 years prior, which is why why don't I feel like I'm 25 again? Well, you can, but but this is why, and that's critical. I mean, if anybody listens to anything, that's the one out of the 50 things that we've talked about already. But oh my God, like it drops by 50% by the time, what was the age you mentioned, by 42, 43, somewhere around 40s, there.
Yeah, 50, that's huge.
A quote unquote middle-aged woman who is expectant of all of these things to happen as far as menopause and just aging in general, just by the general collective mind that they've assumed from 50 years of lack of knowledge and lack of technology and innovation, is just going to say, oh, well, it's because I'm 40. This is 40, right? So, but it's not.
But it's not, and it doesn't have to be, right?
Right.
I also assess lifestyle factors. So we, definitely it's important to know what kind of lifestyle are you living? Are you having heavy alcohol intake? Do you smoke? Are you exercising? How's your diet? Do you prioritize sleep? Do you, prioritize mental health well-being? And so, lifestyle factors certainly contribute as well, but it is, well, let's just say this, we don't have to suffer. And there are things that we can do to help. So I do really like, back to the testosterone, testosterone for women is produced throughout our ovaries and our adrenal glands throughout the lifespan. People think of testosterone being a male hormone. It is absolutely a female hormone as well. It's one of the most abundant hormones that our ovaries produce over the lifespan. People don't know that either. And it is incredibly helpful for women in multiple ways. And again, back to we don't have FDA approval. We just don't have the studies for it yet, but we will. It's getting there. We're being loud and we're saying we need to. Let's go. Yeah. And not having FDA approval means it's not covered by insurance, and that's something. Right. It's a cost for women. So we have lots of studies on testosterone replacement for men and FDA approval, and your insurance will cover it if you qualify under certain conditions. But so testosterone replacement for women can be incredibly helpful. We also look at I assess kind of need for sometimes low dose progesterone. Progesterone is something that also declines in the perimenopause period. Progesterone is our calming hormone. It's incredible for sleep. It's our GABA receptors in our brain love it. So it can be really helpful. So sometimes that's the way I'll approach it. And then when we think about estrogen replacement, that's really based on symptoms. Estrogen replacement is FDA approved for women for what we call vasomotor symptoms. So those are the hot flushes, the night sweats. We know that it's so much, and it's also approved for osteoporosis prevention, but we also know it's so much more important. It's so important for our mood, for our brain, for our cardiovascular health. So those things we don't have indication or on-label use for, but, estrogen replacement kind of comes typically more toward the late menopause transition, when we're having those other symptoms that aren't helped just by, say, testosterone and maybe a little progesterone.
Got it. I mean, I just learned more, I think, in the last 10 minutes about women's hormones, what does and does not exist, and what does and does not disappear at about 40 to 45 than I've ever known. So I have to assume everyone else is doing just the same. So let me ask you this, Kelley, as we start to wrap up here. What would I do, or how would I be able to look you up or check out a website or contact and maybe come see you? In case I'm experiencing any of these things as a man or woman, either in the Fort Lauderdale area or anywhere else in the country. Is that capability that you have? And tell me about that actually, and then tell me how to get to you.
Yeah, sure. So our website, medicalantiaging.com. We have an Instagram. I don't know if you'll put it in the show notes, but our Instagram handle is @medicalanti, one word, _aging. We see patients virtually all over the state of Florida. We are working on our licensing in multi-state. So once we have that up and going, we can see patients virtually from other states, which will just be incredible.
Awesome.
But yes, currently now we see patients in our Fort Lauderdale office, virtually or in person, or all around the state of Florida. Obviously, we can do telehealth. And yeah, it's a good time. I think it's a good time I would say it's a good time to be in midlife for all of us. Because we it's a really we can thrive and really extend the health span and get through this midlife period with grace.
Well, I know you've helped me get through my at least beginning of my midlife, so I appreciate that, and all of your patients do, I'm certain as well. But I appreciate you coming on the show. Great to have you and chat with you a little bit.
Thanks, Jeremy. Appreciate you having me.